I mean, sunset at 5 o'clock.
Well, all of this is a great little toss here, I suppose, to seasonal affective disorder. We want to take a minute to talk about that because as we turn back the clocks and dive deeper into the cooler months ahead, pretty important to acknowledge seasonal affective disorder, or SAD for short. About 10 million Americans suffer from SAD every year in the fall and winter months when the day gets shorter, the less daylight hours, and you end up spending more time in the dark.
Exactly. So as we approach the heart of this season, Dr. Ray Lundy joins us now to talk about ways to combat SAD. Dr. Lundy, thank you for being with us. It's something that I experience every single year. I know fully what it is, but for maybe people who maybe are on the cusp of figuring out if it's something that they too are having troubles with, explain what SAD is and how people experience it.
SAD is a form of clinical depression. It really is actually major depressive disorder that occurs during the fall, typically during the fall and winter months of the year, and subsides in the spring and summertime. Because it's a form of depression, you have to experience it for at least 2 weeks. You notice changes to your day-to-day activities, and essentially SAD is something that is more than just the winter blues. It means that, unfortunately, your serotonin levels have shifted, and there's a little bit something more going on than just being lower mood during the winter months.
So what would you say would be like some of the signs that you might have SAD? Because again, I think for a lot of people, we talked about, you said you don't like the winter. At least for me, I know I don't like the winter. I get, I could call it depressed, but is it really clinical depression? Like, how can you make the distinction and know whether you actually have this disorder or not?
Great question. So the distinction between just the winter blues and SAD would be that if you're noticing things like fatigue, sleep disturbance, if you're noticing things like appetite changes, one of the appetite changes that typically happens with SAD is an increased desire for carbohydrates. Also, if you're noticing a shift in mood, such as irritability, again, that persists for more than 2 weeks. So just regular winter blues or just not feeling great, those types of things don't typically come with the types of disruption that SAD does. And again, if you notice those for over 2 weeks, it may be something to take a little more stock in, to just inquire about a bit more.
Certainly. So what are some of the ways in which we can maybe start to combat this? I'm all about what are active things that we can do to help ourselves, right? Because this is something that lasts for several months. We're really just getting started. What are some of those tips that you give to people maybe with SAD, but even just with winter blues?
I love that you asked about tips, because sometimes when we think about, or when we hear the word depression, it can feel like we're hesitant or we want to push away from that, because that can be scary. But there really are some really meaningful things you can do to support yourself. So I usually like to give my clients 4 different strategies. The first is one that comes to mind when we think about depression, which is move. Get up and move if you can. Physical activity shifts your hormones and the chemicals in your body that are associated with SAD. So physical activity. The next thing, and you all have mentioned this, the sun does not shine as much during the winter and fall months. And so if you can, light therapy is actually a meaningful way to improve your mood. It increases vitamin D, which is what we need, and it also helps with your serotonin and melatonin levels, both of which impact sleep and improve positive mood. Another piece, connect with those that you love. Social connection. One of the things that I tell my clients as well is if you can get connected and have a hug from someone you love, you can improve your mood. So having that interaction with the people in your life that mean the most is really, really impactful. And the final thing I tell folks is that sometimes we really do need clinical support, and that it's okay to ask for help. So I'm a licensed psychologist, so you can talk to someone like myself. You also can talk to a licensed counselor or a psychiatrist. The most important thing, though, is if it passes that mark of 2 weeks where you, again, are experiencing all of those symptoms I've discussed, and it's really impacting your day-to-day functioning, then it's okay for you to seek support, because it's okay to need a little bit more help.
Dr. Lundy, I love every single one of these tips, two of which I try to implement for myself, light therapy being one of them. It is a huge thing that's helped me. I have the little Hatch alarm clock, and I have the light that comes on at certain times of day just to help boost my mood, and I found that that's helped.
Kind of a similar thing, you know, we were talking about how we both don't like winter. I have found, I'm lucky enough that I have a fireplace. I know not everybody has one, but I find that when I make a fire, for some reason, my mood just massively improves immediately. So that's my own little tip, I suppose, but probably doesn't apply to everybody. Dr. Lundy, thank you so much for the time this morning. We really appreciate it.
Glad to be here.